In nursing school, we learn to assess wounds and monitor vitals. But what about this? What do you do when the wound isn't on the body? This is the grieving process. Understanding it isn't optional. It's the difference between treating a patient and truly caring for a human being. By the end of this video, you'll know the models, recognize the signs, and know exactly what to say and what not to say when grief walks into your patient's room. Let's clear something up. Grief is not just about death. You will see grief after amputation, after a colostomy, after a Parkinson's diagnosis, after a patient loses their independence and can no longer live alone. Grief is the emotional response to loss. The family grieves, and sometimes, if you're honest, you as the nurse will grieve too. So why do we struggle to recognize grief? Because it rarely shows up the way textbooks describe. It disguises itself. Your patient who keeps asking the same question? That's grief. Your patient who won't eat?
No.
That's grief. Your patient who lashes out because you're 5 minutes late? That's also grief. The most famous model is Kubler-Ross. Denial, anger, bargaining, depression, acceptance. You've memorized these. But here's what nursing school doesn't emphasize. These are not a line. A patient can wake up in acceptance, fall into anger by lunch, and be bargaining by dinner. Let me show you what this actually looks like. This patient received a terminal diagnosis on Monday. Watch her journey. Day 1, she threw her water pitcher. Day 2, she asked the chaplain if she could make a deal with God. Day 3, she told her daughter, "The doctors are wrong. I'm going home next week." Kubler-Ross describes what you go through. Worden's 4 tasks describes what you do. This model is more useful for nurses because it gives you something to observe. Task 1. Accept the reality of the loss. Not agree with it. Accept it. This is the patient who finally says, "Okay, this is happening." Task 2. Process the pain of grief. This is the patient who cries, who talks about it, who lets it out instead of holding it in. Task 3. Adjust to a world without. This is the patient who starts asking practical questions. How do I shower now? How do I cook? Task 4. Find enduring connection while moving forward. This is the patient who keeps a photo at the bedside, or the amputee who says, "I lost my leg, but I'm still me." Here's where you become the nurse who catches what others miss. Grief shows up in 4 domains, and most healthcare workers only look for one. Emotional is obvious. Sadness, anger, guilt, but also numbness. A patient who feels nothing is still grieving. They're just protecting themselves. Physical is the one most nurses dismiss. I'm tired. My chest feels heavy. I can't sleep. These are not complaints. These are manifestations. The body grieves. Cognitive is the one that gets patients labeled as difficult. Confusion, forgetting instructions, inability to focus. Your patient who keeps asking the same question? Brain is flooded with grief. Behavioral is what you see. Withdrawal, restlessness, crying, or the opposite, busyness. The patient who won't stop organizing their bedside table. That's grief in motion. These 4 domains are your assessment. You don't need a new tool. You just need to know what you're looking at. So now you know what grief looks like. What do you actually do? Let me give you 4 interventions. None of them require a doctor's order. Number 1, sit down. Not on the edge of the bed with your hand on the door. Sit in the chair. Studies show when a nurse sits, patients perceive the conversation as 3 times longer. You just gave them 3 times more presence without spending 3 times more time. Number 2, use silence. When a patient shares something painful, your instinct is to fill the space. Resist it. Count to 7 in your head. Let them be the one to speak next. Number 3, name it. You don't need to fix it. You just need to acknowledge it. Watch the difference. Wrong approach. Don't cry, you're so strong. He's in a better place. Right approach. I can see this is really heavy. I'm sorry. I'm here. Number 4, never say these 3 things. He's in a better place. You're so strong. Everything happens for a reason. These shut down grief. They tell the patient, your pain makes me uncomfortable. Instead, try this. I don't have words for this, but I'm here. That's it. That's the intervention. One more thing. You will grieve too. You will lose patients you fought for. You will watch families fall apart. You will carry stories home that don't belong to you. This is not weakness. It's evidence that you cared. And the same rules apply to you. Acknowledge it. Name it. Sit with it. Do not say, I'm fine, when you're not. You cannot pour from an empty cup. So before you walk into that patient's room, make sure you have something to give. If this video helped you, subscribe. More nursing students need to see that fundamentals aren't just about skills. They're about presence. Take care of yourselves. Take care of each other. And I'll see you in the next one.